Oral hygiene on an unconscious patient. We'll be demonstrating this skill on a mannequin. The supplies that you'll need an emesis basin, tongue depressor, a cup of water, your gloves, and your toothettes. The toothettes come in a package. We just removed several of them from the package before we got started with the skill. You're going to provide privacy for this skill, and of course you're going to put on your gloves. And you're going to explain to the patient that you will be performing mouth care. Even though the patient's unconscious, you want to speak to the patient just as you would any other patient.
Good morning, Miss Mannequin. My name is Cherie, and I'm going to be performing mouth care on you.
With mouth care for the unconscious patient, you do use the toothettes rather than a toothbrush and toothpaste. Notice that she's wringing the toothette out on the side of the cup so that there's a minimal amount of water. You don't want water dripping into the patient's mouth. Your unconscious patients usually are not able to swallow. Going to hold the mouth open with the tongue depressor. Never put your fingers into the mouth of the unconscious patient. And then you go around the surfaces of the teeth and clean, basically like you would if you were brushing the teeth. You're covering the same surfaces as you would if you were brushing the teeth. You'll use however many toothettes it actually takes to clean the patient's mouth. Frequently, you may find that it takes several toothettes to get their mouth completely clean. Never put your fingers into the mouth of an unconscious patient. They frequently still have a bite reflex, and they may bite down on your fingers. If you were not able to get their teeth apart using the tongue depressor, then you would just need to let the nurse know that you were unable to get inside to do mouth care. You could still clean the outer surfaces of the teeth, but never force anything, even the tongue depressor, into their mouth.
Make sure I get the tongue.
You're going to clean the tongue as well as the teeth and the roof of the mouth, the cheeks. Let's say basically the same surfaces you clean when you're brushing your own teeth. Going to dispose of any disposable materials into the trash can. Your basin you will empty, rinse, and dry. You're going to empty, rinse, and dry the basin. Place it in the dirty supply area. Remove your gloves without contaminating yourself. Dispose of the gloves.
Wash my hands.
You wash your hands. Skill complete.